Wondering about bug bites with spring coming up, Christoph. Is there anything you suggest? Bug bites, spider bites, snake bites is probably more severe. But first of all, for people going out in the woods, is there anything preventative? And then what would you put on after a bite or something like that?
Yeah, I mean, with mosquitoes, there are a number of essential oils which are quite strongly mosquito repellent. Any lemon-like, not lemon by itself, but there is the lemon eucalyptus called Eucalyptus sitiodora, there's citronella, there's lemongrass. All these, first of all, have a good effect. And then there is one essential oil, very expensive, but very, very potent. You need very little of it, and that is the catnip essential oils. Cats like it, mosquitoes hate it. So in our Bugs Be Gone, we have among a number of essential oils, we have also a little bit catnip essential oil in there. We have also essential oils in there which repel ants, that's peppermint, and a few other things. In recent times we added a little bit vanilla, because vanilla is the one scent, strangely enough, which helps against the gnats, which suddenly had been around a lot. So once you've bitten, you have an inflammatory response. You do the usual anti-inflammatory oils, helichrysum, maybe German chamomile. If it's not so bad, lavender. If you have just lavender, that's all you have. You always should have lavender. Just try lavender. That already does something. I won't say anything about the snakes. That would be very inappropriate. And it would create false hopes. If you've bitten by a snake, get medical help as quickly as possible. And most of all, what you can do with snake bites, there's always something. The biggest concern with snake bites, and I believe even I was told this, the largest numbers of deaths from snake bites did not occur from the venom, but from the anxiety shock. So anxiety-free to deal with the shock. It can be quite shocking being bitten by the snake, and shock. The physiological shock response is a natural response which has its good thing. If you are in a car accident and your dearest friend right on your side is dead, you're completely shocked, and the shock response, if it's not overpowering, still helps you to function in an extreme situation. But if that shock response gets out of control because suddenly you're bitten yourself and you think, my God, I'm gonna die now, then you may actually die. So stabilize yourself with stress-free or anxiety-free so you're still in that functional range. So that's one thing I can recommend, but otherwise get medical help.
Can I ask a question?
Yeah, we have time, yeah.
You were talking about German chamomile for anti-inflammatory, like would that be good? It's a twofold question. One, would that be good for anti-inflammatory for, say, muscle spasms and that kind of thing? And then what do you do if you have that issue but you're sensitive to ragweed?
Yeah, right. Muscle spasms commonly, or muscle pain commonly, is not an inflammatory response. The typical example for extreme muscle spasm, it could be stress, manager stress. Some people, everything is cramped completely. When the manager who works 60, 80 hours a week comes to its weekly masseuse, the masseuse notices everything is completely uptight and completely cramped. There's an oil called Roman chamomile. It is so powerful as any synthetic allopathic spasmolyticum. I have repeatedly, not just one person, but different people, treated in an acute asthma attack. In an asthma attack, people cannot breathe anymore because everything is cramped. And if you never had been exposed to that, you wonder what you say, you can't breathe, just breathe. No, they can't. And the next thing, when you see something like the next thing is intensive care unit. And I have repeatedly people stabilized completely where the situation was. Okay, next thing is intensive care unit. By massaging Roman chamomile in a seed oil on the chest and on the back, it smooths it completely out. They can breathe again. Muscle pain from overuse is a different story. I recommend sweet marjoram there. Sweet marjoram. Yeah, that's there are so many different things, and the nice thing is with aromatherapy and essential oils, if one oil, which would be the right oil for that situation, for some reason we cannot use it on that patient, on that situation, there's 1, 2, 3 or 4 other oils.